So we're going to talk about this morning. Good morning, Dr. Hood's Network. I hope you all are having a great start to your holiday season. We're going to talk about this morning when patients want to withdraw consent and what is the proper way to handle that. So we know withdrawing consent is always up to the patient. So when they sign their consent, it's not a contract. They're not obligated to complete the entire study. And then for whatever reason, and they don't have to provide a reason, they can just say, hey, I don't want to participate anymore, and we have to honor that. However, a lot of times sponsors will like us to offer the participant the opportunity to do what's called safety checks. So instead of coming into the clinic, you can continue to give that participant a phone call on their scheduled visits to assess for AEs, SAEs, and changes in concomitant meds. And this way we still can get a feel of if they have exhibited any side effects to the investigational product that they were on, of course, if it's an investigational study. Ideally, we would like to get them to come in to do what's called a end of study visit. So that means we'll get the last set of labs, the last set of vital signs, and then at that point that they can either decide to completely withdraw or allow us to do the safety checks. So once you've offered that option, if the patient still indicates, I don't even want to do that, I want to just withdraw consent, then you complete what's called the end of study page. And so for the reason, you will indicate withdraw consent and the date in which that was done, and then you will also place that information into the electronic data capture system. So it's nothing further for you to do. You tried your best to obtain their willingness to participate in safety checks, and they declined. Now, if they are willing to participate, and at some point they change their mind and they want to start back completing the visits, have that discussion with the sponsor to ensure that that patient can be allowed to come back to start their safety. Start their visits. And if they say it's okay, then that patient can just resume the visits like they normally would. Now, if they decide to do just safety checks, unfortunately, the participant will get protocol deviations for every assessment that was due at that visit that was not complete. So vital signs were due or lab draws were due, and they are allowing us to continue safety checks at those interim visits, then the site will receive protocol deviations for those assessments not complete. However, again, we are getting that safety information as far as changes in their meds and whether they have undergone adverse event. So it's still not the full picture, but it gives us some insight of how the participant is doing, and that is beneficial for the study. Also, some studies are designed where participants can do a dose interruption. So if it's a study that's going over a long period of time, it may be designed where the patient can stop meds for a while, and then again you just get those. They just come in for their regular visits, get their vital signs, assess for AEs and changes in concomitant meds, and then they resume the medication when they desire to. Also, the investigator has the discretion to interrupt drug when he feels or she feels like the drug is causing safety issues, and whether that drug is started back will be up to whatever side effects that were causing has been resolved and a discussion with the medical monitor has taken place. So I just wanted to, you know, we've talked about informed consents in the past, but I wanted to talk about, you know, what happens when the participant chooses to withdraw an informed consent.